Hey everybody, it's Cognitive Behavior Therapy. Some Greek philosophers said it is not events that disturb people, it is their judgments concerning them. So we have our king of cognitive behavioral therapy here, Aaron Beck. Started cognitive behavioral therapy, changing people's thoughts in the 1960s. There he is with his wife Judith, who also is published. So cognition from the Latin cogniti, getting to know, acquaintance, a notion or knowledge. Changing people's thoughts will result in behavioral change and emotional regulation. So how does change occur? The client's going to look happy, hopefully. CBT is not intended for long-term therapy. So change occurs when thoughts can be changed. Thoughts cause behavior and emotional dysregulation for those in therapy. So a happy client would recognize that his thoughts about a certain negative or over-exaggerative thought shift their thoughts, and the behavior and bad feelings will fall in line. So what is the role of the counselor? So of course we have to have a therapeutic role, trusting is necessary, but the counselor plays the role of a teacher and a cognitive reconstructionist. It is definitely opposite the egalitarian feminist and non-judgmental Carl Rogers. So there are a lot of techniques that you can use as a cognitive behavior therapist, but the basis for it, from my understanding, is automatic thought record. So basically the client is taught to recognize the relationship between their thoughts and their behavior. And then once this is established as a foundation, then the therapist's position is to teach the client various cognitive reconstructing techniques, which is retraining their brain, in order to cope with stress. Like teachers, you may want to give homework assignments. This would take a level of commitment from the client, which is the reason a therapeutic relationship must be formed for trust. Video analysis, CBT for depression, and what I found interesting. It is very efficacious, according to our book and online, that CBT is effective for depression and many other mood disorders. But teaching someone to rethink seems like a daunting task. I was surprised to learn it was short-term therapy, but then understand that as a cognitive reconstructionist, which to me is an important role, and the role of a teacher seems difficult. Usually these clients are adept to dealing with stress, but are just kind of going through a rough patch, are taught some techniques to cope, and then move on with their normal lives. CBT for me seems like an unsupportive environment, and I wondered if Claire in our video was being authentic. Depression is very serious, as it could be asymptomatic of suicide or suicidal ideation, so therapy must be effective. I think I would opt for a different kind of strategy when dealing with depressed clients, like unconditional positive regard, maybe from Carl Rogers, or some existential therapy. So that's my presentation on CBT. Thank you guys. See you on Monday.